A new report shows both progress and ongoing challenges for Louisiana's air quality. The American Lung Association's State of the Air report is a mixed bag for us here in Louisiana. Here's a look at their findings. Well, I am here with Eric Weinzettel, the Advocacy Director with the American Lung Association. Eric, thank you so much for being with me today.
Thank you so much for having me, Dorothea.
Yeah. Now, we have this report about our air quality. Talk to us about that.
Yeah, so we have published our 26th edition of our State of the Air. It is one of our 3 signature reports that the American Lung Association puts out every year. And what it does is it analyzes air quality across the nation and grades it off of 3 levels, which are our ozone levels, our daily particulate levels, and then our year-long exposure to particulate levels. We have one for each state, and so of course we're here talking about Louisiana.
Yes, we are.
And unfortunately, we are seeing a downwards trend here in Louisiana. Across the state, we're kind of seeing a lowering of numbers. We give grades on those 3 metrics that we were talking about, and we've seen lower in all 3, unfortunately.
Yeah, so let's talk about Louisiana and our numbers. Now, you said the numbers are lowering. What impacts does that have on our health here?
A huge amount. When we're talking about ozone levels, we're seeing that could have a serious health effects, serious health defects for people who are susceptible to these kind of things, people with asthma, lung disease, older population, or the very young. Particulate matter, specifically short-term spikes in particulate matter, we can see acute effects such as coughing, wheezing, shortness of breath, and that is actually what can lead to lung cancer.
Now, I know earlier we were just chatting and you talked about the relationship you have with Cancer Society and American Heart Association. Why those in particular? Does the air quality affect those organs as well?
Absolutely. Air quality affects all parts of the body. Now, of course, the air becomes filtered through the lungs, but what affects the lungs will affect the rest of the body. It will enter into our bloodstream and will have that negative effects across the whole body, not just in our lungs.
So I see why there's the correlation there. So I wanted to talk about the burden of air pollution on communities of color. Talk to me about that.
Unfortunately, what we see across the United States, and especially here in Louisiana, is communities of color are disproportionately affected by these burdens of air quality, these larger days with worse outcomes where you see more of these F ratings that we're seeing. Probably the most infamous example is Cancer Alley. You know, it is a majority black populations, and they are exposed to some of the worst exposures that we've seen in the entire country.
Wow, that's interesting there. So what can we do, Eric? How can we fight this? What can we do as a community, as a state, to combat this air pollution problem?
The first thing I would say is to be informed. A lot of us don't know, and perhaps we were exposed to it a couple years ago when Louisiana had those kind of unprecedented wildfires, right? We realized we were learning about what bad days meant, what purple days meant, like what do all of these air quality things mean for me? And so the first thing you can do is check the air quality before you go out, especially if you are one of those populations who are more susceptible to bad air quality. Go to airnow.gov to check what kind of air quality you have, and if you have the ability to shape your schedule around it. If you are someone who exercises outside and you see that it's a bad air quality day, shift that to indoor exercise, or stay indoors more if you can. Other ways we can do it, aside from just being informed, is to advocate. We can go to lung.org/SOTA. We have a bevy of resources for you to not only educate yourself, but to get involved. What we're really looking at right now is at the federal level is that we really want to protect the Environmental Protection Agency, the EPA. They are under threat of losing a lot of funding and reverting a lot of the great work we've done and setting up the metrics that we have to protect people. So calling on your senators and your congresspeople to support the EPA and increase that funding. And then at the local level, get involved, see what's happening, work with your council members, anything we can to promote healthy air at the local level as well.
Thank you. I love that. Any final thoughts, Eric?
I think one of the most impactful things we say at the Lung Association that really resonates with me is that when you can't breathe, nothing else matters.
That's powerful.
It is, and it should let everybody know that the air we breathe, this is not a partisan issue. This is something that matters to everybody at all ages, of all demographics. We all rely on healthy air to live good life. And so I would say make your support loud and proud, keep yourself informed, and do what you can.
Awesome. I love that. Thank you so much for being with us today.
Absolutely. Thank you so much.
Such a great cause. So important. The air we breathe.
Absolutely. Thank you.